convenient, fits their lifestyle. It's good for the physician because now I can get another patient in who actually literally needs to see me physically. We had a 71% increase in the interval for diabetic patients. And then the one that might be counterintuitive, but in fact was really quite positive, was the heart failure patient. And in fact, the interval went down for that patient, which meant they came into the office more frequently. But what you don't see here is that they didn't end up being transported by an ambulance to an emergency room and then being admitted to an intensive care unit. One visit to an emergency room for us is equivalent to 15 visits coming into the office, and one visit to an intensive care unit is like a lifetime's worth of visits going forward. So to answer the question, is digital health here to stay? The answer is it's absolutely necessary. We have 77 million Americans that are going to go from being 35 to 55 to 55 to 75, the highest period of healthcare utilization in the country in your lifetime. It's the biggest cohort that's moving into that. There are not enough physicians to treat them in the traditional model. So we must move here. These tools have to work effectively if we're going to deliver great care to all the patients that we serve. Thank you.
Good morning. I'm Dick Migliori. I'm from UnitedHealth Group. Just to give you a little explanation around UnitedHealth Group, we are a health services company. We provide benefits to now 1 in 5 Americans through our benefit companies. You know us as our brands as UnitedHealthcare and the like. We can only serve these people by building strong partnerships with the vibrant and vital medical community. We have relationships with well over 85% of all available hospitals, pharmacies, and physicians across the country. We operate at a rather large scale. We process over 1 million claims every day. In fact, when you look at all of our transactions, we operate at a scale that's about 51 billion transactions per year. That's rich information. That information belongs back in the hands of the people who generated it, the patients and their physicians, to help them make better decisions and to get better access. A little bit about our company. You may be familiar with our brands, UnitedHealthcare, serving employers, serving the federal government through Medicare Advantage programs, Med-Sup programs with AARP, et cetera, and Part D programs, and then likewise the Medicaid programs at the state level. We also found it very necessary to get expert here, which are in our services companies. Companies that help us take that data we generate and turn it into usable information and give it back to the health system to help it operate better. Companies that work like Optum Health to engage consumers so that they make better decisions and support them as they make those better decisions, and companies like Prescription Solutions to help them to get competitive access to some of the best drugs that exist. 2 things about technology that make it indispensable. It will be laid out and I'll be done with my 5 minutes. The first of which is helping these 2 people at the center of the healthcare universe make better decisions. If you're generating that much in the way of healthcare information on a daily basis, and you can use technology that can analyze what has happened on behalf of each individual for the reasons that they have it, we've built a virtual medical record room for those 70 million Americans. We can also test it against rules to make sure that what we have is good evidence-based medicine being practiced and understand where it's not, what's missing, what may be excessive, et cetera. And then tools to track to make sure that it's happened. When we apply that kind of intelligence to the system in terms of decision support and share it with the patient and share it with the physician, we see a 20% improvement in the likelihood that people will do the right thing according to evidence-based medical standards. But we also find another use for technology, and that's what's exciting and it's emerging. And it's the ability to use handheld tools to get access to that information. We do like Chipotle. So we built a tool called Doc GPS. fact, it's out there if you got a special phone. Or that limitation is it's either got to be a BlackBerry, an Android-based phone, or an iPad, or an iPhone. And it's free to you. If you download it, it looks at where you are and will show you by specialty all physicians within your radius, by distance. And it ranks them by their quality and efficiency of their practice. And I invite you to come by to our booth and you can play with the device and see how it works if you haven't downloaded it already. Oh, by the way, it also is tied to Google Maps, so you know how to get there. And it's got their contact information. If you can't make the appointment themselves and you're a UnitedHealth Group member, we'll make the appointment for you. But by the way, this app is available to you no matter who your insurer is, if you carry insurance at all. It's free. Better decisions, a key element of information, makes it indispensable. The other part of technology is dealing exactly with what Martin was describing and what Cheryl was leading to as well, which is we are going to be short some 45,000 primary care physicians in America by the end of this decade. We do not have sufficient capacity to deliver to people the care that they need. We have to dramatically transform the structure of the healthcare system, the way in which it operates, and support them with better tools. That's where technology comes in. Building connections amongst all the variety of sites where healthcare can be delivered, expanding the roles of all licensed professionals. You can see here what Walgreens done to bring the nurse practitioner and the pharmacist into direct care management, but to do it in a way in which it's an integral part of the healthcare system. And that may mean that we're putting it into mobile trucks, as we have already. It may mean using telemedicine clinics, either in remote rural areas, so that way primary care physicians out in the remote areas can have connections with consultations with specialist experts. In the worksite office where we've been implementing them, as well as putting it into mobile handheld devices so that you have that kind of decision support that we talked about earlier, right in your own hip pocket. In order for healthcare's transformation to be sustainable, we've got to improve its quality and we've got to continue to make it more affordable. That makes technology and digital health something that's not only indispensable, but as any transplant surgeon as myself would say, it's one of those vital organs. Thank you, Cheryl.
Thank you very much. What I'd like to do now is talk a little bit about, one, what you've heard, but also some of the things that are key on our minds as we think about how digital health is going to help us going forward in the work that's already begun. You've heard from an insurer's perspective and the amount of work that's going on there, and actually work that's being measured and showing improved outcomes. From a healthcare system and looking at their population of patients, but also looking at what does that mean across a country. From a pharmacy retail healthcare clinic like Walgreens, and from Harry, who shared with you, he's developing the tools for all of us. And we're all working together. In some way, we all have a relationship. So it's a great thing, even though there are people on this stage who may not have met before, our companies are working together within this healthcare ecosystem already. I'd like to start off with a first question. And I'm going to start it off to Dr. Migliori. How do we get practicing physicians to use more digital health tools? So should insurers pay for those since they're going to help lower healthcare costs? Should it be linked to a healthcare system, so it's a healthcare system plus the physicians who work with them who are going to do that? And yes, Martin, that question will come your way.